My name is Katie, and I am a freshman in the School of Nursing here at the University of Michigan. I will be presenting a patient to you. Patient is an 18-year-old Caucasian female. She is single and lives in a dormitory with a roommate. She is a full-time student here at the University of Michigan. Chief complaint: supraventricular tachycardia, also known as SVT. Patient also has premature atrial contractions known as PACs, meaning she gets extra heartbeats that are not supposed to be there. The SVC is more of a complaint to the patient than the PACs. Patient's vitals: 98.6 degrees Fahrenheit temperature, blood pressure of 117/76, pulse of 98, and respiratory rate was 18. Present history or history of present illnesses. Patient was diagnosed at age 5 with SVC. At age 14, patient had a catheter ablation done. After the surgery, patient started having the PACs, which still occur to this day. Patient states that she has episodes of PACs, however, they are not noticeable except for in an EKG. Patient reports that the PACs are not noticeable, but there is still a premature beat. Patient states that with SVT, exercising or even standing up can affect her heart rate. When an episode arises, patient finds laying down and resting to be alleviating. Patient takes digoxin every morning to help treat it and sees a cardiologist 3 times a year. Patient also wears Holter monitors up to 2 times a year to measure progress. Patient started noticing the heart problems at age 5, but besides that, she reports living a healthy lifestyle. She has never had any other serious illnesses or issues. Patient is up to date on immunizations, including also receiving an annual flu shot. Patient does not have any known allergies or drug reactions. Patient's only surgery was an ablation at age 14. Hospitalizations: 3 different times due to the SVTs and PACs to monitor heart rate overnight. Medications: 25 milligrams of digoxin each morning for SVTs and PACs. Health history: no other serious issues up to date on immunizations, no known allergies or drug reactions. Health habits: patient does not partake in any drug or alcohol use and has never smoked. She exercises once weekly and reports 6 hours of sleep per night with frequent naps during the day. Patient eats healthy, gets daily fruit intake, and 4 months ago she cut out pop from her diet. Psychosocial data: patient reports a moderately high level of stress in her life due to general life stressors like college and her health. When the patient is having an episode, it makes her extra anxious. Patient always reports using seatbelts, sunscreen, and other safety devices. The SVT does not interfere with her daily activities unless there is a rise in an episode, then she has to go lay down. Patient gets along with family well. Her support system is made up of her mother, father, and extended family members. Patient does not have any major environmental hazards, but is from Chicago, so is occasionally exposed to pollution. Family's history: patient's maternal grandmother passed away of breast cancer at 46 years old, and her paternal grandfather died of liver cancer at age 55. Now we will move on to the review of systems. Since patient has SVC and PAC, I chose to do the cardiovascular system assessment. Patient does not experience any chest pain, arm or jaw numbness. Patient does not have a history of heart disease or heart murmurs. Patient can walk up to a mile before her heart starts to feel distressed. Patient does not have any difficulty laying flat, and that actually helps her symptoms. She typically sleeps with 1 pillow at night and does not usually experience any difficulty sleeping. Patient has palpitations once every 2 weeks. It causes minimal distress for the patient. The second assessment conducted on the patient was peripheral vascular. So for the review of systems, the patient does experience any pain in the legs. She does not experience calves, thighs, or hips while walking. Patient has never noted any edema, coolness, or hair loss on her extremities. Patient has never had a blood clot. Patient's mother and father both have varicose veins, but she does not have any. During the cardiovascular examination, I inspected and palpated lifts in the second intercostal space left of the sternal border known as the aortic spot. The patient's contour of her chest was flat and not barrel-chested or concaved. No heaves or thrills present. While palpating the PMI, the patient had a thrusting pulse. I then auscultated with both the bell and diaphragm in the key 5 areas of the heart. Aortic, the second left intercostal space left of the sternal border, the pulmonic area, which is second intercostal space right of the sternal border, the third intercostal space left of the sternal border, known as Erb's point, the tricuspid area at the fifth intercostal space left of the sternal border, and lastly, the mitral or apical area at the fifth intercostal space left of the midclavicular line. While auscultating, the patient's heart was beating rapidly. No S3 or S4 sounds heard. In a supine position, I auscultated with the diaphragm and bell again and was able to hear the rapid heart sounds even more pronounced. I was easily able to identify the S1 and S2 sounds of her heart, which sounds like lub-dub. The S1 heart sound is the first heart sound, or the lub, that is heard when the atrioventricular valves are closing. During the time of systole, the ventricles are contracting. The S2 heart sound is the second heart sound, or the dub sound, that is heard when the semilunar valves are closing. During the time of diastole, the ventricles are relaxed. Abnormal findings would include a heart murmur, where it sounds like a blowing or whooshing sound caused by turbulent blood flow. S3 and S4 sounds would also be documented as abnormal findings. The S3 sound immediately follows the S2 sound and is heard as lub-dub-ta with an emphasis on the ta. An S4 sound is caused by blood being pushed against a stiff left ventricle, and you would hear that as ta-lub-dub with an emphasis on the ta at the beginning. No murmurs, S3 or S4 sounds heard. Apical pulse was conducted since patient's heart rate was so elevated. I had the patient lay on her left side as S3 and S4 sounds are heard more clearly. After auscultating with my bell, no S3 or S4 sounds were heard. Next, I will describe to you my findings from the peripheral vascular system. No visible swelling, edema, or varicosities. Hair distribution was equal and color in patient's lower extremities was evenly distributed. Beginning the palpation of the patient's pulses, the temporal was rated at a 2+, the carotid was a 3+, brachial 3+, radial 2+, femoral 3+, popliteal 2+, posterior tibial 2+, and the dorsalis pedis 2+. Pulses are graded on a 0 to 4+ scale, with 0 being absent, 1+ is weak, 2+ is normal, 3+ is strong, and 4+ is bounding. While palpating, no varicosities, edema, or tenderness was felt. I rated the patient's edema as 0 because the skin did not stay indented as I pressed my finger down on her lower leg. Skin was warm to touch. Capillary refill was under 2 seconds in both fingers and toes. Now we will move on to the pertinent systems that will be important given the patient's health history. First, I would choose to perform a neurological assessment because when the patient is stressed about her heart episodes or other life stresses, she tends to get migraines, which occur about once a week. This is important because according to Mayo Clinic, patients with a high amount of stress are more likely to get a migraine than those who are not. They say constant mental stress can cause migraines. Stress damages your body, and if your mind isn't able to control it effectively, that can be a problem. For the next pertinent system, I would conduct a respiratory examination since the patient did have a rapid heartbeat. Stress can also be another factor to increase heart rate. According to CardioSmart American College of Cardiology, stress can cause shortness of breath or make it worse. Once you start feeling short of breath, it is common to get nervous or anxious. This can make your shortness of breath even worse. With the patient reporting stress in her life and experiencing stress related to an already elevated heart rate, the respiratory assessment would be another key examination to conduct on patient. For both migraines and an increased heart rate, the patient could practice taking deep breaths or other coping techniques to help lower her stress levels. This concludes the patient interview documentations. Thank you.